What tests are used for pheochromocytoma screening? Have you ever wondered how doctors screen for pheochromocytoma, a rare tumor that can cause high blood pressure? Let's break down the tests used in this important process. Pheochromocytoma is linked to excess catecholamine production, which can lead to hypertension. The screening process primarily involves biochemical tests followed by imaging studies if needed. First up are the biochemical tests. One of the most common tests is the Plasma Free Metanephrines test. This blood test measures free metanephrines, which are metabolites of catecholamines like adrenaline and noradrenaline. This test is highly sensitive, with accuracy up to 99%. Elevated levels of plasma normetanephrine or metanephrine can strongly indicate the presence of pheochromocytoma. Next, we have the 24-hour Urine Metanephrines test. This test collects urine over a full day to measure metanephrine and normetanephrine levels. It is considered very reliable and helps reduce false positives that can occur with plasma tests. If the levels are more than twice the upper limit of normal, it strongly suggests pheochromocytoma. However, mild elevations can happen in patients with hypertension without the tumor, so doctors interpret these results in context. Additional urine tests can measure catecholamines like epinephrine and norepinephrine, along with their metabolites such as vanillylmandelic acid. These tests are less sensitive than the metanephrine tests but can still provide useful information. If the results from the biochemical tests are unclear, doctors may use the Clonidine Suppression Test. This test checks how well the body can suppress catecholamine levels. If the levels do not drop after taking clonidine, it may suggest the presence of pheochromocytoma. Once biochemical tests indicate a potential tumor, imaging studies are performed to locate it. Computed tomography or magnetic resonance imaging are standard methods used to detect adrenal masses. If these scans do not provide clear results, functional imaging techniques such as 123-imetaiodobenzoylguanidine scintigraphy or 18F-fluoridopamine positron emission tomography can help identify tumors, especially those located outside the adrenal glands. Screening for pheochromocytoma is particularly important for patients experiencing sudden or severe hypertension, resistant hypertension that does not respond to treatment, or hypertension accompanied by symptoms like headaches, palpitations, and sweating. Younger patients with hypertension or hypertensive crises during anesthesia should also be screened. Early detection through these tests allows for targeted treatment, often involving surgical removal of the tumor, which can resolve or improve hypertension caused by excess catecholamines. Before surgery, controlling blood pressure with alpha blockers is essential to prevent hypertensive crises. In summary, the screening process for pheochromocytoma relies on measuring plasma-free metanephrines or 24-hour urine metanephrines, followed by imaging studies to locate the tumor. These steps are vital in managing hypertension associated with this tumor.